As CNAs, we typically have more than one job. So a lot of us will be working at 2 to 3, 4 facilities through a staffing agency. They send you to different facilities to work. I was working with Wise Medical Staffing, and I was with them at the time when I got sick with COVID-19. The CDC guidelines was people that had underlying health conditions shouldn't work with COVID patient, because a lot of people that was actually dying from COVID was people who had underlying health issues. I knew that I had asthma, I knew that I had lupus, and I told them I could not work with patients that were COVID patients for those reasons. They ended up sending me to Summer Trade. Summer Trade was a COVID facility. But when I got there, I wasn't on a COVID unit. It was a skill unit at first. I was on a skill unit. After my third day of working there, a patient from the COVID unit walked over to our unit, and she said that they hadn't had nobody there to take care of them within 24 hours. They hadn't ate breakfast. There was no nurse to give them their meds. I was upset about it. My heart dropped, you know. So I did go over there and take care of them voluntarily at that time, because there was nobody to take care of them. When I went on to the unit, it was disgusting. You had a dead body on the floor. You had a lady that was not hooked up to her feeding tube. People were soaking wet, hadn't been changed, begging and crying to me not to let them die. You don't even know if the night shift even did anything. I cried. I was angry. I was frustrated. I was so mad that I had to call my sister, who is an RN, to literally calm me down. I had to pick the dead body off the floor, put him in the bed to make him feel like a human being. You know, even though he wasn't there, but he still needed to be treated as a human being. When people come to the hospital, they put their trust in us. They trust in us to give them the best information that we possibly can, to give them the best care that we possibly can, and to make sure we're saving their lives. Here it is, 40-some people, nobody showed up. So since COVID-19, a lot of people stopped trusting the healthcare. The next day I came back there, they ended up scheduling me again, actually putting me on the COVID unit by myself to take care of all those people. After the second day, I ended up getting sick. I ended up taking off 2 days from there. And so I informed the agency that I did not want to go back there. I cannot work with them consistently because I have health issues. I ended up happening to go to Miracle Nursing Home. They didn't tell me that it was a COVID facility also. They didn't have me working on a COVID unit. They had me working on the second floor. And I did that for about a week. And then like the second week, sure enough, the nurse put me on the third floor with COVID patient. So at that time, I called them. I said, listen, you told me that this was not a COVID facility. I didn't have to worry about working with COVID patient. They're putting me on a COVID unit. When I told you that I have health issues. You see, the last time when I worked at Summer Trade, how quickly I got sick. The night shift supervisor through Wise Medical was like, well, if you leave, I'm going to report your license and you're going to be fired. So I did not want to lose my license, and I definitely did not want to be terminated, because at that time, that was the only agency that I was working for, the only income that I had. So I went ahead and worked the COVID unit. They put a lot of healthcare workers' life in jeopardy. A lot of these DONs, administrators, was keeping that hazard pay from their workers, not giving them the proper pay to be working in a hazard environment, not making sure their employees get sick pay for being off from work. A lot of them had people working with COVID. Even though the CDC said you should not work, they had workers actually that was positive working because they didn't have symptoms. I remember the day that I think I really contracted COVID because the DON, she was doing swab with the patients. And she asked me to help her with one resident. And when we went in there for her to swab him, he was fighting and he pulled down my mask. 3 days later, I ended up having to be rushed from there because my blood pressure was high. I couldn't breathe. And I went to Mount Carmel Hospital. I think it was June the 29th. They tested me for COVID, but they said I didn't have COVID. I had bronchitis. So they gave me 3 days off. At that time, I went back working there because, I didn't want to lose my income. I needed money, so I went back. And then July the 11th, I had to go to the hospital to get tested, and I was positive. It's very important to have a post-COVID doctor because dealing with all these other doctors, they're not going to say that your symptoms was due to post-COVID. And if they're not saying that, then that can stop you from even being awarded to get paid or to, getting less money or not getting anything at all. And even though with me having a post-COVID doctor, they only gave me $15,000 because that's what my life was worth to them, $15,000. They ain't concerned about all the other health issues that I had to go through and how I was off for 2 years, not being able to work, not having no income, the health issue that I still face every day, that wasn't put into consideration.